All right, so this particular PowerPoint will get into the immune system. There may be a background noise when I'm recording because I think my computer is basically has had it in terms of just using it at this point. Anyway, so in terms of the immune system, what you want to do is take out your slide, the one that says part one, and you want to make a chart for yourself where you at the very top you put immune system and you think about all the different components that are really important in the immune system. So you have the bone marrow where you get your stem cells, that's one thing. Then you have the lymphoid tissue, which you can find lymph tissue basically throughout your whole body. So you can find lymph tissue in the GI system, in the respiratory system, and so you find little pockets of lymphoid tissue, and there's basically they're all there to basically protect you, right? And then there's the spleen, right? So all these three main components are involved in some way in protecting you. So the bone marrow, the lymphoid tissue, as well as the spleen. And this information, of course, is on your slides. What you want to do is once you get to that part, start pulling out the information that's important for you. Okay. Then with the bone marrow itself, you want to make two lines. So one line is going to go to the B lymphocytes. So it's important for you to understand that there's what is known as a humoral response. And then on the other side, you're going to write down T lymphocytes, and you're going to call that the cell-mediated response. So the way that your body protects you primarily is via the bone marrow, the lymphoid tissue, and the spleen. But when it comes specifically to the immune response itself, you have the B lymphocytes and you have the T lymphocytes. The B lymphocytes are primarily with the humoral response, and then the T lymphocytes are with the cell-mediated response. So under the B lymphocytes, they go directly into your circulation. The response with the humoral response is very specific. The B lymphocytes, they mature in the bone marrow. Then they go to the circulation. The main cells that are involved under the humoral response on the B lymphocytes are the memory cells. They recognize any antigens, as well as the plasma cells. They are the ones that are responsible for creating antibodies. So they produce antibodies which bind to antigens. So under the humoral response, you know that it's a specific response. You know that they're memory cells, and you know that there's plasma cells that basically create antibodies. On the other side, you have the cell-mediated response, which is with the T lymphocytes. So for this one, the cells go to the thymus first, and there's no antibodies that are involved, but there's phagocytosis, there's cytokines that are released, there's what is known as helper T cells, there's suppressor T cells, and there's cytotoxic T cells, which are also known as the killer T cells. So just be able to pull everything apart and really look at it clearly. All right, so here you have a whole bunch of different types of objectives. You have to be able to basically contrast humoral versus cell-mediated immunity. We'll talk about hypersensitivity later on. And this particular PowerPoint will end up being broken up probably into two because there's just so much information under each one. We'll talk about the inflammatory response. We'll talk about, which you're very familiar with at this point. And we'll talk about some of the allergic reactions that can potentially happen in your patients. Okay. All right, so immune response basically kicks into gear when any of these things are present. So whether it's bacteria, whether it's toxins, whether it's viruses or parasites, your body basically is trying to protect you as much as it can. You are thinking of immunity as a war between our body and any invading types of organisms. So your body's trying to protect you, right? It's trying to make sure that you are okay. So it's a body-specific protective response to an invading organism or foreign agent. And the immune response to do this, it does three main things, right? So there's a defense component, right? There's a rapid response to a foreign substance in a very specific manner that can happen. So remember, this could be something maybe under the humoral response, where there's a very specific response that happens and then you're building antibodies. So that could be one example. The other component is homeostasis. So your immune system tries to basically digest and remove any damaged cells. It clears the way, right, so that your body's as healthy and as strong as it can be. And there's also the component of surveillance. So it recognizes mutations as foreign cells and destroys them. So it's always like kind of scouting out there, checking out the territory, making sure that everything is okay. If there's any weird cells that are present, then it basically tries to destroy them and get rid of them. All of this is what your body is trying to do to keep you nice, healthy, and strong. All right, so your major components. So remember, like I said earlier, all cells are involved in immunity. All cells involved in immunity, like all other blood cells, are produced in the bone marrow. So here specifically, we're talking about the bone marrow, right? So here we're getting white blood cells that are produced in the bone marrow. Specifically, we're talking about the stem cells. So you may have heard, or from your reading, you may have seen that stem cells are undifferentiated cells. What does undifferentiated mean? It means that these cells can basically turn into anything, right? And this is the big controversy that happens when you listen to the news, because if you're trying to cure particular diseases, everybody's trying to get themselves some stem cells, because they can usually get those stem cells and they can make those stem cells into healthy tissue, and potentially they can cure other types of immune types of disorders in some cases. So stem cells have the potential to turn into anything. Initially, when we talked about the bone marrow, we talked about the fact that you have stem cells, and later on from the stem cells, you can have your B lymphocytes or even your T lymphocytes. So that's the capacity of what stem cells can do. Some of them become B lymphocytes, some of them become T lymphocytes, but then there's a whole bunch of other things that they can also become as well. All right. So your B lymphocytes mature in the bone marrow, and then they enter circulation. Your T lymphocytes go to the thymus to mature into several kinds of cells with different functions. So this is the same exact thing we just finished talking about. So bone marrow, you have your stem cells. So you have what are known as B lymphocytes, and you have what are known as T lymphocytes. B lymphocytes going directly to your circulation, and your T lymphocytes going straight to your thymus. This particular picture is just letting you know the size of the thymus in relation to the body at different stages in life. So look at how big the thymus is in a fetus when the baby's just born, right? So it's really, really big, because there's a lot for the thymus to do in terms of protecting that baby, right? Because they don't have really an immune system then. They haven't gotten sick, they haven't gotten vaccinations, all those good things. So here the thymus is huge because it's trying to protect the body as well as it can. But when you're looking at the thymus in the older patient, an older adult, is small in comparison to their body, because now we've gotten sick, we've gotten maybe antibodies, we've gotten vaccinations, etc. So our immune system is much stronger at this point. So our thymus gland is going to look much smaller. All right, so the other component we talked about, so remember we said we have the bone marrow, the lymphoid tissue, and then the spleen as being our main components that are helping us out with our immune system. So lymphoid tissue is the second group, and we'll talk about lymphoid tissue later on. And then we have the spleen. So the spleen has red and white pulp. The spleen primarily is acting as a filter. There's what is considered red pulp that's primarily responsible for getting rid of any red blood cells that are injured, defective RBCs, destroying them and getting rid of them, any types of microorganisms, all of that is doing. And then with the white pulp, it contains concentrations of lymphocytes, and they're lined with macrophages as well. So their job is to basically to engulf and destroy any microorganisms that may be present. So the interesting feature about the spleen is that you can live without it, but obviously because of what it does, which is things like filtration, destroying old red blood cells, engulfing microorganisms, then if you don't have a spleen, of course you're going to be more immunocompromised to infections and diseases, right? So it is entirely possible for you to live without it. Because the bone marrow will pick up the slack, the lymphoid tissue will pick up the slack, etc. But just know that you are at risk though, right? So you still would want to do teaching about the patient not getting illnesses. All right, and that's just a picture letting you know where your spleen is if you weren't sure. Just another picture showing you all the different components. All right, so this particular slide is specifically talking about the lymphoid tissue, right? So remember, bone marrow, lymphoid tissue, and spleen. So specifically now we're looking at the lymphoid tissue. So we know that it's distributed throughout the body. We know it's in the submucosa of the respiratory system. You still have tonsils and bronchioles there. You have your GI tract. You have your GI tract as well, genitourinary tract as well. So you have lymph channels and capillaries that are removing foreign material before it enters the bloodstream. Also serves as a center for immune cell proliferation. So lymphoid tissue, highly, highly, highly valued. So this is a picture showing you all the different places where you can find your lymphoid tissue, your lymph nodes. So there you go, under the armpit area over there. So anything that is, let's see here, anything that is purple. So here, right? So on the neck area here, right? Over here and here, all of that, right? And you see your spleen is over here. So, you know, your body's an amazing thing. Our body's an amazing thing. And it's really, really trying to fight off infection as much as we can. So your neck, your axilla, your abdomen, all of those are areas that can potentially get swollen, especially when you get sick, right? You don't feel well, and that's a sign that something is going on that shouldn't be going on. And the nodes are also important when we start talking about cancer, because when they're staging cancer, they also count the number of lymph nodes that are involved. The more lymph nodes are involved, that means the cancer has basically metastasized, so that becomes even more of a problem for a patient. So that's just something to keep in mind when we're talking about cancer later on. All right, so now we're talking about the humoral response. So remember, we talked about your bone marrow stem cells that can become B lymphocytes, and they can also become T lymphocytes. So specifically now we're focusing on the humoral response. You are not going to keep these separate necessarily, because they do work together. So your humoral response as well as your cell-mediated response, it's a whole system in your body that's working, and we'll see how that looks like in a little while. But there are some components that you kind of have to know, okay, that belongs under humoral, that belongs under cell-mediated. So we already mentioned this. You know it goes directly into circulation. You know that here under the humoral response, the way it manifests itself is that you have memory cells. So these are cells responsible for recognizing antigens from previous exposure and mounting an immune response. So you've gotten sick before, you've gotten some antibodies produced, right? Because the plasma cells are present here. So responsible for producing specific antibodies. So each cell produces and excretes a specific antibody to a specific antigen. The antibody binds the agent, marking it for destruction. All right, so this is all considered a humoral response. It's a very specific response. Antibodies are produced. It has memory cells that remember, particular antigens, and then they mount an immune response with that. All right. B lymphocytes, memory cells that recognize antigens, plasma cells that produce antibodies that bind to antigens. All of this is considered your humoral response, and you already know that it goes directly into your circulation. On the other hand, we have what is known as your cell-mediated response. So these are your T lymphocytes, which go to the thymus, and then they mature into helper T cells. These activate and steer other types of cells. The suppressor T cells that shuts down the immune response when it's no longer needed. Because once again, you don't want to have this immune response going on forever and ever and ever. So for instance, if your antibodies were being created because you came into contact with some weird thing, at some point you want all of that to stop. Like, okay, fine, stop. B lymphocytes, we don't need that anymore. So you need something that says, okay, time to stop. I think we're good now. And also there's what is known as a cytotoxic T cell. So these are killer T cells. They kill anything that doesn't belong in your body. So a cell-mediated response is T lymphocytes that go to the thymus and mature into helper T cells, suppressor T cells, and cytotoxic T cells. Once again, they all work together. All right, so same thing. Helper T cell activation, suppressor T cells shuts down the immune response, and cytotoxic T cells are known as the killer T cells. In terms of the comparison, humoral response versus the cell-mediated response, so it's literally the same thing we've been talking about again, and it's repetitious because you do have to be familiar with some of these responses. You know, B lymphocytes is in circulation. You know that there's memory cells. You know that there's plasma cells. You know that you get antibodies, and you get the binding that happens to antigens. And you know that for the cell-mediated response, it's the T lymphocytes primarily, and that they've got the thymus, and you know that they're helper T cells, suppressor T cells, and killer T cells. And you know that the humoral response is more specific. Yeah, much more specific. All right, so suppressor T cells here turning off the immune system. They're basically saying, hey, stop B cells, you can stop now. You know, we don't need any more antibodies, let's say, being produced. You've done your job. This is good enough, right? So everything is working together. All right. Helper T cells bind to B cells, which display a specific antigen, and then help recruit macrophages and neutrophils to the site. So remember, the helper T cells were from the T lymphocytes, right? But the system works together. So they are binding to the B cells once again and saying, hey, okay, we're good. Well, in this case, the helper T cells are bringing along macrophages and neutrophils. So they're trying to help out with whatever the B cells has identified, right? So the helper T cells are helping out. Keyword is they're helping out. Versus the suppressor T cells are suppressing. They're saying, hey, B cells, stop. But the helper T cells are saying, hey, we got some other people here that can help us. We've got macrophages, neutrophils, and all of this is going to help with the immune system. So it's a type of cross-helping that happens. All right, so we're now going to talk about the two different types of immunity. Only at 17 minutes, so I'll probably just still continue this audio. It's fine. So when it comes to immunity, the bigger pieces are that you need to know natural versus adaptive. So notice that natural is called innate versus adaptive, which you acquire during your lifetime, right? So natural is, you know, present at birth. It's rapid, it's not specific. It's basically just what you have to help you out at the very beginning. And then the adaptive is acquired during your lifetime at some point, so it's not present at birth. So it's usually because of exposure to an antigen. So either you got sick yourself, and that's how come you are now immune, or maybe you're given a vaccine, some type of immunization, and so it is particularly recognizing a specific antigen. So that is important to be able to tell the two, like innate versus adaptive. And you see later on that they've actually subdivided adaptive into different types. So is the adaptive a natural type, or is it an artificial type? So those are the different ways you want to think about. So once you've gotten this part, like natural versus natural versus adaptive, the bigger piece would be the adaptive side is the one that gets broken down further, and that's the one you have to focus on so that you understand what's happening in your body. So other ways that they can describe adaptive is they can say, is it active versus passive? So this is specifically for adaptive. Is it active or is it passive? So if it's active, it means that you made it by the body yourself. You got sick, and that's how come you now have the active type of immunity, which is also a type of adaptive immunity, right? So maybe you got the chicken pox or something like that. Or was it passive? Was the type of adaptive immunity, did you get it via a passive way? Was it coming from outside your body? So that would be like something like an immunization, for instance. Another way they may ask you, is it for the adaptive still we're talking about, is it natural or is it artificial? So if it's natural, it could be something that the mother gave to the baby, right? It's passive, so it's maternal, and the mother passed it on to the baby by breastfeeding. That's a natural thing, right? It's real. Or is it artificial? Or artificial is always the same. Is it the vaccine? Is it immunization, immunoglobulin that they've created, whatever it is? So really adaptive is the one that can be described in different ways, but I mean the information is on your slides either way, so you can see how they break it down further. All right. So your WBCs participate in both natural and acquired immune response. Um, So that's the key word always. Is it natural versus is it acquired? So just get familiar with that terminology. So this is just some background information. So you have neutrophils, eosinophils, and basophils. So all of these are WBCs that are basically releasing cell mediators. So it can be things like histamine, bradykinin, prostaglandins to engulf the foreign bodies or toxins. So everything is trying to help you in some way. And these are histamine, bradykinin, prostaglandins. You're familiar with these because they are part of your inflammatory response, right? They're letting your blood vessels dilate. They're causing things like inflammation, pain, and fever, in particular for the prostaglandins, as all as part of your kind of healing response as well. So this you should be familiar with already. Your monocytes, they're fighting invasion by functioning as phagocytic cells. The lymphocytes, we already talked about these, could be either humoral or cell-mediated. So all of this is a part of your cells that are trying to help you to keep you well. All right. So under the adaptive, once again, so remember we have natural innate versus adaptive acquired. So now we're specifically looking at the adaptive acquired side. So it could be active, meaning that your body, the person's own body, is the one that's creating this type of immunity. So obviously you probably got sick, and that's why now you're immune to this particular thing. So that's one way they can describe it. It's considered long-lasting, like a lifetime type of defense after you've gotten sick. Ideally, you shouldn't have to worry about that particular illness anymore because you're basically immune to it after that. That's basically the understanding behind that. They are saying, though, that sometimes that can kind of get less over time, that the immune response can get less over time. But I think as it is now, the idea is that once you get sick from something, chickenpox, immune, you don't have to worry about it pretty much. And then passive means you're getting the adaptive type of immunity from outside. So it comes from a source outside the body. So either breastfeeding, you're getting an immune globulin infusion. And this one is considered temporary when there's no time for the body to create its own. So breastfeeding, obviously, the baby is new. They don't have their full defense. And so that's helping them until they can build their own immune system. And then immunoglobulin as well. These are some therapies that can give the patient to bump up their immune system. Some patients apparently are born without like really strong immune systems, so they are given specific immune globulins to, and it's considered therapy, or like even antibodies actually that help that particular patient to fight off infections for a while. All right. So here, just another way of describing it. So immunity, you have adaptive immunity, so adaptive acquired versus innate natural immunity, right? So the adaptive, remember, it can be natural, right? Where it's something like a living being that the body basically is transferring. Either it's natural from the mother to the baby, or it's the you getting sick by yourself. And this is how they're deciding to describe the natural here. So you're becoming sick, right? So these are considered natural forms, or it could be artificial, something that's created, right? So the passive antibody transfer, let's say, that somebody's getting, they consider that artificial, or an immunization that you're being given, right? That would be considered artificial. So there are different ways you can make this table, right? So you don't have to memorize this, but you just have to be able to understand from the very beginning that you have innate versus adaptive, and then there are different ways there that you can describe all of that. All right, and this is just some crazy picture they have. Key things are probably the things on the end here. With the macrophages, they're doing pathogen uptake and elimination, and then the cytokines here, inflammatory reaction and shock can happen from that. Interferons, attack on viruses, that's part of your autoimmunity. Cytotoxic T cells, attack on virus, bacteria, tumors. B cells, attack by antibody release, that can be found in allergic reactions. So once again, no need to memorize this particular page. All right, so in terms of the phases of the immune response that can happen in your body. So there's some type of injury or perceived threat that happens. So there's a recognition stage, a proliferation stage, and a response stage or effector stage. So injury or perceived threat, so it doesn't matter what it is. Something happens to your natural barriers, right? Skin mucus, acidic, gastric contents, whatever. Something happens to it, to your protective mechanisms, right? Then you have an immune response, you have your WBC's differentiation basically beginning, like do I need, humoral versus cell-mediated, whatever. All of that happens. And then you isolate and destroy the pathogen, and the idea is you want to minimize blood loss as much as possible and protect your tissue to the best of your ability. All right, so examples of what a humoral response may look like in your body. So things like anaphylaxis, allergic hay fever and asthma, immune complex diseases, these would be considered to be humoral response types of reactions. And remember, in the humoral response, you have memory cells that are involved, you have plasma cells that are involved with the antibodies, and you know that it's a very specific reaction that's going on. For the cell-mediated response, so how this may look in your body may be in transplant rejection, delayed hypersensitivity, tumor surveillance or destruction, intracellular infections, viral, fungal, and parasitic infections. So remember, under your cell-mediated, you had your specifically your helper T cells, suppressor T cells, and cytotoxic T cells. So in particular, like for the transplant, your T cells would be involved with that, right? Your cytotoxic T cells are seeing that transplant as being foreign and they're attacking it. And we'll talk more about some of this later on when we're talking about the hypersensitivity reactions. All right, so humoral response once again, so antigen recognition, we know about B lymphocytes being activated. We know that they produce antibodies to specific antigens, and we know they're specific, right? So B lymphocytes are for humoral immunity. And then for the cellular immune response, we know that the T cells attack foreign invaders directly rather than by producing antibodies. So no antibodies under the cellular immune response. All right. This response can, however, be triggered by the B lymphocytes, right? If something is going on, because remember everything is working together. So then your cell immune response would also come into play, basically trying to figure out, okay, in what ways can we help? We know that specifically we have your T cells, so they help on cytotoxic produce substances which break down cell membranes. Suppressor T cells keeps the immune response in check, and you know that there's memory T cells that recognize antigens from the previous exposure. So this is just a picture of everything working together, because you know that your memory T cells are part of your humoral response. You know that the B lymphocytes up here are part of your humoral response. So this is just trying to explain that, in order to keep you safe and strong, everything basically is working in conjunction. Another picture of just all your leukocytes and their particular components and how you end up with your B cells, T cells here, and your natural killer cells. All right, so major function of the immune system here is basically to keep away pathogens and any microorganisms, right? that's the main thing that's supposed to be going on. You have what is known as an inflammatory response. So this is primarily what we're going to be talking about now, right? So you do have things basically happening in a very, very strategic manner. Um, you have, let's see, all these different things that needs to happen, especially the three means of defense in response to pathogens. You have a phagocytic immune response, humoral antibody immune response, and you have a cellular immune response that can be going on, right? The sequential reaction to cell injuries, you have neutralizing and diluting inflammatory agents, removing necrotic materials, establishing an environment for healing and repair. So this is all part of your inflammatory response that can be instigated as well. All right, so doesn't matter what the issue is, once again, in terms of keeping your body safe, right? In terms of activating your inflammatory response. Some type of disruption has happened to tissue integrity, whether it's an injury, ischemic damage, or an immune reaction, it doesn't matter. But these different things will bring about your inflammatory response. And at this point, you guys are familiar with this response. So vascular changes, vasodilation, capillary permeability, increased blood flow, local tissue congestion can happen. At the cellular level, you're getting things like phagocytosis, increased leukocytes, release of chemical mediators, things like mast cells and macrophages. Your mast cells are chemical mediators. That includes things like histamine. And then what happens with that, you're getting things like erythema, you're getting edema, right? Getting contraction going on, all of that, the regular things that happen. And then your body responds in a particular way. Is it a local effect or is it a systemic? For the systemic effects, it's usually if there's also an infection present, then that becomes, travels to your body. Like if you have an invading microorganism and it's an infection, then you're going to be seeing more systemic types of effects. If maybe it's just your body was burnt or something, a small piece, maybe you had a sunburn or something, in terms of the inflammatory response, it's going to be maybe local. So you're going to be getting things like redness, warm, swelling, pain, and loss of function. Let's say your arm was burnt or your finger was burnt. That's loss of function. Maybe you won't be able to use your finger like you normally would when you're trying to write or something like that, or you can't use your hand like you normally would, right? So just know that you can have local effects as an end result from the inflammatory response, or systemic if it's something like microorganisms really, invading your body and then traveling to other parts of your system. All right, so when it comes to the inflammatory response, there's just some key concepts to understand. So inflammation is not the same as an infection, right? I think you can kind of understand that. Inflammation is an expected response. Inflammation is always present with an infection. Infection, though, is not always present with an inflammation, right? So somebody can have an inflammation because they had a burn or something like that. Maybe somebody pinched them, right? And that's why they have an inflammation. But you don't necessarily need to have an infection there to have an inflammation. That's all that's saying. So don't make it complicated at all, because it's not. Nothing else there. For the infection to happen, usually you're getting things like bacteria, fungi, and viruses going on. For the inflammation, potentially things like heat, radiation, trauma, and allergens could be a factor. If an infection is present with an inflammation, it's from a superimposed invasion of microorganisms. You're going to need some type of microorganism to be present in order to have an infection either way. That's the takeaway. In terms of the inflammatory response, continued, so let's see, the mechanism of inflammation is basically the same regardless of the injuring agent. The intensity of the response depends on the extent and severity of the injury. So how big your inflammatory response, once again, is going to depend on how big the extent and severity of the injury is. And it's also going to depend on the reactive capacity of the injured person. So how strong is this patient's normal immune system anyway, their body, right? Can they fight off a burn and it's no big deal, or are they already compromised in some way? And now when the inflammatory response starts, maybe it's 10 times worse in that patient, right? So all those little things. So this is the same information we talked about already. So you know that there's a vascular response that happens, things like vasodilation, increasing capillary permeability, collection of fluid in the tissue, and then it becomes edematous. And then there's a cellular response with the neutrophils, monocytes, right? WBCs rushing to the area. You're getting things like chemotaxis, which is just cytokines, chemicals, all those things showing up to basically be a part of this process. Neutrophils are usually the leukocytes, and the first leukocytes to arrive, right? So they're doing different things, phagocytizing bacteria, damaged cells. And depending on how damaged you are, if that's all you needed was a couple of neutrophils, then that's the end of it, right? They do their job, and then it stops there. But if your body's not as strong, then maybe you may need to progress to other things. All right, so over here is just a picture of a boil skin abscess that can happen in some patients. All right, local response versus systemic response. I think we've talked about this already. So local response, redness, heat, pain, swelling, loss of function. Systemic response, let's see, increased WBC count with a shift to the left. So when they say a shift to the left, it basically just means that you have an increased amount of immature WBCs. So it usually means that there's an infection present in some way. And remember we said systemic responses are not going to just happen like that. There's usually some type of microorganism or infection going on. So increased WBC count with a shift to the left, increased numbers of immature white blood cells, usually indicating that there is an infection there. Things like malaise, nausea, anorexia, increased pulse, increased respirations, and a fever. The fever mechanism itself is poorly understood. They're not really sure 100% how a fever gets cooked up in everybody. So, and apparently it only happens with certain types of bacteria in some patients. So I would wager that it probably has to do with the patient's immune response to begin with. All right. Here we have the, so we're talking about the part of the fever response here. So triggered by the release of cytokines. Cytokines have ability to initiate metabolic changes in the temperature regulating center. Prostaglandins increase the thermostatic set point by sending messages to the hypothalamus. So this is part of the process that normally happens in order to cook up a nice little temperature for the patient. All right. So some of the explanations for why these things are going on in your body. So things like redness, hyperemia from vasodilation, heat, increased metabolism at inflammatory site, pain. It's primarily things like histamine, prostaglandins, and then swelling, fluid shifts that can happen, fluid exudate accumulation, and potentially loss of function because of the swelling and the pain. So I was giving the example of your fingers, maybe they're swollen and you can't use them as you once did. And these are pretty much primarily under the local local manifestations that you might see in your patient. All right, so this was a brief introduction to your immune system. We talked about the inflammatory response, so hopefully you have a good understanding now. Sorry about the background noise. I just can't seem to stop it here.